Hi, this is Yafi Lavova, registered dietitian nutritionist with Baby Bloom Nutrition, and welcome to Naptime Nutrition. Today I'll be talking about the milk transition at 12 months and what is the deal with goat milk and infants. So first, that milk transition. It's been a really popular question lately. It's interesting how these questions come in waves. But the major question is, at 12 months, you transition to milk. What kind of milk? What kind of milk should I choose? What if we don't have dairy? What if I want to use an alternative milk? How do I transition? How do I know how much milk to give? Well, some of those have been answered in other Naptime nutritions that I've done. I did one Naptime nutrition called Milk Addiction, which addresses how much milk your child should be having at various stages. And I also did another Naptime nutrition on calcium and milk alternatives. So you might want to check those out. But this one, we're talking about the actual transition to milk and what you can use as milk alternatives before 12 months. So first thing, we transition at 12 months, and we don't transition before that. A lot of that is because of, my girl is almost 2 and still only wants boob. Yeah, well, that's what you get for extended breastfeeding. Thumbs up to you. I can't help you there. So anyway, we transition at 12 months largely because that is the point when a baby's body is ready to transition away from human breast milk as its number one source of nutrition. And that doesn't mean you have to stop, like Tiffany's comment, still breastfeeding at 2. That's perfectly fine. I really support extended breastfeeding. At 12 months, the baby's major source of nutrition is going to be solid foods. So some people choose at that point to stop breastfeeding, and that's perfectly fine as well. But we don't do that before. We don't transition before. So a question that I often get is, why can you have dairy before 12 months but not to drink? Why is it okay to give your child yogurt and cheese but not a cup of milk? Well, here's the thing. You could give a cup of milk just for flavor, for taste, but it's not going to meet any nutritional. You don't want it to meet their nutritional needs because I'm going to get into exactly why cow's milk and goat's milk do not meet the nutritional needs of a child earlier than 12 months. But you can give them a sip here and there. It's not a big deal. But the reason why you can give yogurt and other types of dairy that are not actual milk to drink is because it falls into the solid foods category. They're still experimenting. They're still understanding and learning the whole sensory experience of eating. So they're not going to be meeting their nutrition needs with those foods. They do have some nutritional benefit, but largely before 12 months, we're really just looking to food for practice, for exposure, for social skills. There are a lot of reasons, but it's not nutrition. So it's fine to include dairy products before 12 months. We're just not giving dairy milk to drink, or almond milk to drink for that matter. Any fluids you're going to be given, it's really going to be breast milk or formula. And then after that, you're looking at water. And I also did a Naptime nutrition on water last week, the week before, I'm not sure. Thanksgiving, you know. So a big reason we really need to focus on the timing for that milk transition is because of, I mentioned the biological development of the child, kidneys and intestines. As it's amazing how your child learns to speak slowly. You know, they don't just start with sentences, and they learn how to walk slowly. They don't just get up and run across the room. And it's the same with eating. You're going to start, and your body catches up as you give it more nutrition, and as your baby is able to take food and put it in his or her mouth and chew and swallow, as they get more proficient at that, the body gets more proficient at digesting it. And it all happens in sync in a healthy circumstance. And I guess that's good timing for my disclaimer. All my Naptime nutritions are geared towards happy, healthy children who are neurologically not usually on the spectrum. I did one Naptime nutrition on spectrum disorder, but otherwise, any information that you get from me is for the masses, does not necessarily pertain to your individual needs. If you do have individual needs, please contact me. I can work one-on-one. But you should never take mass-given medical or nutrition advice for your own situation without discussing it with your doctor or dietitian one-on-one. So here's the deal. this whole goat milk thing has been coming up a lot as far as can you give goat milk to an infant if you don't have enough milk? And I'm going to start by saying no. A lot of people will tell you, well, but my great grandmother says that her doctor told her that breast milk wasn't good, so they gave us goat milk. Yeah, that did happen. And a lot of cultures do use goat milk. That does not mean that it's ideal. And in those times, I think it's always amazing when people compare what we're doing now to what we were doing 200-300 years ago and think that we didn't have the research that we do now. And the mortality rate was super high. So you're not going to say, like, oh, a third of infants who were not breastfed died very early during this time period, but we're going to use that as our point of comparison for what you should do. That doesn't make any sense. Right now, we have the most up-to-date research. That's what up-to-date means. Right now, we have the most information that we've ever had, and it's really best to go off of the current data. And that's not to say that we're not going to have more updated data 50 years from now. I'm definitely open to that, but we have to go on the best information we have right now, and that tells us that we do not do goat's milk as a breast milk or a baby formula alternative. You can introduce it as a healthy drink instead of cow's milk at 12 months. That's a perfectly acceptable thing to do. But as far as before that 12-month mark, you have breast milk, you have formula. That's what you're doing. You're not doing anything else. And I'll get into why. Human milk, which was developed and intended for human babies, is higher in fat. It contains DHA and ARA, which are not found in cow's milk or goat's milk. Those are important for nervous system development, and that's where you're going to get your gross and your fine motor skills. That development relies upon specific fat composition that is provided in human milk, and it's also now provided in certain formulas, but it is not provided in cow's milk or goat's milk that has not been modified. What does that mean? Well, baby formula is based in cow's milk or soy, or some now are based in goat's milk, but those are modified. And that means that you take that milk and you change it to better meet the needs of the infant. You're adding things, you're taking out certain things, you're diluting certain things. And really, fresh from the source is really not intended for babies, for human babies. So the fatty acid composition is different. In human milk, there is a much higher amount of poly and monounsaturated fats, whereas in goat milk, it's very high in saturated fat. I am definitely not anti-saturated fat, but what you need to know is that human milk has a specific fatty acid composition for a reason. It meets the needs of the human baby. When you're talking about using coconut oil versus avocado oil, that's a whole different argument. Right now, we're talking about human milk and human milk alternatives for infants. Carbohydrates. Goat's milk and cow's milk do not have oligosaccharides, which oligosaccharides are an important factor in human milk, and they decrease risk of GI infection. So you're at a higher risk of having certain GI infections, which can lead to GI bleeding in infants if you're giving them cow or goat milk. And that bleeding happens, it's in about 40% of infants, and leads to anemia because you're losing blood through the intestinal wall. Also, concerning protein, there is much less protein in human milk versus cow's milk or goat's milk. The protein is easier to digest. I mean, to give you some numbers, as far as 1 cup of milk, human milk has 2.53 grams of protein versus cow's milk 7.86 and goat's milk 8.69 grams of protein per cup. And for some reason in society today, we think protein equals good. No, it doesn't. The right amount of protein equals good, just the same as the right amount of carbohydrate and the right amount of fat. We have specific needs, and human milk is intended for human babies. Goats need more fat. If you want to look at the hooded seal, their milk is 60% fat because they need to develop that amount of fat in their body for their own survival because they have unique needs. And all mammals have unique needs from each other, which is why our own milk is ideal for us. the whey and casein ratio are very different. So you've probably heard of casein and whey in cow's milk. It's also in goat's milk. It's also in human milk. But when a woman starts lactating, when she's feeding a very young infant, it's 90 to 10, the ratio of casein to whey, or of whey to casein, sorry. And as you get further in your lactation journey, it's 60-40, and then it's 50-50. And it's very different in cow's milk and goat's milk, and that it changes how it's going to be digested by the infant. There is a big argument about iron and copper. The amounts are very different in cow's milk and goat's milk than in human milk. This leads to anemia because those nutrients are needed for red blood cell growth. So it's red blood cell synthesis. And when you don't have those nutrients, you don't have the proper synthesis of those blood components, which leads to anemia, which is a huge problem with infants around the world. They're very high in calcium, phosphorus, and sodium, which can lead to kidney damage. And not only does it lead to kidney damage, but in the short term, it leads to dehydration because you have those amount of electrolytes, because those are all electrolytes, it causes a shift in the fluids in the blood and causes the kidneys to release more water, which leads to dehydration in the infant. Goat's milk is very low in folate, and folate is very important in a lot of different body systems. I'm sure you've heard a lot in the news. Sometimes folate and folic acid are used interchangeably, kind of a pet peeve of mine, but it's a very important B vitamin that's used for a lot of different processes in the body. It's very necessary. And if your child is on goat milk, they're not getting that folate. The issue is not only what goes in the mouth. It's very short-sighted to make an argument based on, well, if we change it this way, it's this amount of protein and it's that amount of carbohydrate and this can match human milk. That's not the only story. It's how does it affect the body once it's inside? What is the fat composition? What is the length of the protein? How is it digested and absorbed? Cow's milk inhibits iron absorption. If you have been diagnosed with iron deficiency anemia, you might have heard that having cheese at the same meal as having foods high in iron can actually bind that iron and prevent you from absorbing it. And this is a really big problem with giving cow's milk, unmodified cow's milk to infants, because it inhibits that iron absorption. So not only is cow's milk low in iron, but it prevents the baby from absorbing other sources of iron, should there be any at all. Anyway, as I mentioned, 40% of infants have an increased intestinal blood loss with cow's milk consumption. And I am talking again about unmodified cow's milk. I'm not talking about cow's milk-based formula, which is modified. That problem stops at about a year, which is another reason why you can give milk to drink at a year, but not before then. So why is it okay to have cow's milk or goat's milk or soy-based formula, but it's not okay to give them to drink? Well, formula is based in that protein. It's based in that milk, but it's modified. And it's modified by experts in a controlled environment. There is a lot of science that goes into determining how the breakdown is going to be, what's going to be included. And there really are experts in charge of that, and you want to leave this to them. There are a lot of homemade formula recipes that you can get. I had to take a breath because it's a very big deal. There are a lot of dangers with that, and this is another time when you can say, well, people have been doing this for a long time. Yes, and it's decreasing, and the infant mortality is decreasing as well. So you run the risk of infections if you're making these at home. It's like the honey issue, and that's another thing. Some of these recipes include honey, which you do not give to a child under 12 months because of the risk of botulism. There's no botulism in honey after that? No, of course there is, but your body can fight it off. Infants have a developing immune system, and if they're exposed to some kind of pathogen before they really get a good immune system going, it could really be harmful. And that same bacteria in the same dosage is not going to harm a child who is even a few months older, because the development that happens in just a few months in their immune system is so significant. Nutrition inadequacy. some of these recipes are off the wall. If you look at some of these, it's, go get some goat's milk powder and Karo syrup and put in some probiotics. It does not meet an infant's needs. Just don't do it. Also, mistakes. When's the last time you baked a batch of muffins and forgot to put in the eggs or forgot to put in the baking soda or whatever? It's not such a big deal. You end up with some flat muffins, but if you were to make the tiniest error in making an infant formula, you could kill your baby. God forbid. You could. I did a Naptime Nutrition on hydration and why you shouldn't dilute your formula. And it's a very big deal for to have too much hydration. You really could cause a lot of damage, brain damage. So just don't do that. It's really best to buy the store-bought formulas. So how to transition? Well, getting back to the healthy aspect of transitioning, there are different ways to transition. It depends where you are. It's a really good time to introduce a sippy cup. Ideally with a flexible straw, because we're finding more and more about those sippy cups damaging teeth and not developing the swallow muscles very well. So giving them a sippy cup with a straw at 12 months is a good idea. And you can start with, here's some breast milk, okay, and now here's some milk in a cup and see how they do. If there's some GI discomfort, you can pump milk. You can do 3/4 breast milk and then 1/4 cow's milk or milk alternative, what have you, at 12 months. And start to transition that way. And you have to do what works well for you. You have to, give a few sips here and there as they get used to the taste and the texture, and maybe it's probably a different temperature. They'll get a little bit more used to it and they'll take more. There are a lot of questions about, well, I'm going back to work and the baby won't take the bottle. And I'm going to post a link when I'm done with the broadcast that has 29 ideas on how to get your baby to take a bottle. And that applies to either pumped breast milk prior to that 12 months or after with the sippy cup. So I hope you enjoy that. And if you have any questions, please feel free to comment below. I don't have a topic picked out for next week, so please, any suggestions you have, any questions you have, I often turn conversations into Naptime Nutritions. So here are your bullet points from today. Transition to milk that's not breast milk or formula at 12 months and not before. Introduce it with a sippy cup rather than a bottle if possible. And do not do cow's milk or goat milk or camel milk or donkey milk or hooded seal milk prior to 12 months. So thank you, and I will see you next week. Feel free to follow me on Facebook, Pinterest, Instagram. Come to Toddler Test Kitchen if you're a Phoenix local. And I also do individual and small group counseling. So come visit me at babyboomnutrition.com. Thanks.